And welcome back to your questions. Esther says, I've been having the same symptoms as Sarah. Anasema amekuwa na weight loss, severe cough, fast heartbeat, sweating at night, and the neck is swollen on both sides. She had a recent test which showed that there was an enlarging mass. She also says that she has swollen lymph nodes. So she's wondering, is there a medication which she can take to shrink the mass? Mwingine anasema that the sister also has similar thyroid problems, and so she's following for her. Thank you for that. Another asks, I have had 2 surgeries for goiter, one in 1984, another in 1991. So unfortunately, she says that my left vocal nerve was paralyzed, causing me to have noisy breathing, and I snore at night. Last question asks, what kind of diagnosis do I need to do to determine the wellness of my thyroid gland? So Daktari, maybe we just want to look at tumeongelea mambo ya upasuaji, and of course surgery scares most people. That's why people are asking, is there something else we can do? Maybe what are some of the common complications that we can expect baada ya operation ya tezi la thyroid? So
behind the thyroid, there are structures. One of the common glands that are there called the parathyroids.
No.
There are 4 small glands.
Things, yes.
Alafu pia kuna laryngeal nerve inakuja pale juu ambayo ina control voice box. These are some of the rare complications that can happen during surgery, maybe, but squeezy ni ngumu sana. No. Especially to interfere with all the 4 parathyroid glands. If you get a good surgeon, they will spare them. Now, if they are interfered, you'll get your calcium going too low, and that is a very rare complication, and it's a really bad one. Interference with the nerve is also a rare complication, but it happens in some situations. Remember, this is, it's practice, so something can go wrong. Yeah. And there are other ways that can be avoided if you are a candidate for what we call radioiodine therapy, where you're just given a pill which is radioactive and you swallow, and it goes and shrinks the thyroid gland and makes it not be able to produce the excess thyroid hormone. Na pia kuna swali ambayo tumeulizwa hapa kuwa gland yangu imefura lakini tukipimwa tunapata thyroid function iko sawa. Yeah. So hiyo tunaita non-toxic goiter. So utapata sana hii iko either na genetic predisposition, utapata either you are iodine deficient, unaweza pata pengine ni puberty, pengine ni pregnancy. Kuna vitu vingi ambavyo vina cause hiyo non-toxic goiter. Treatment for non-toxic goiter most of the time kama hainterfere na kumeza kuongea nini tunaweza achana nayo, lakini for cosmetic purposes unaweza toa. You get it? Na pia kuna hizi mitindo mpya zinaingia tunaita radio frequency ablation. Ndio zinaingia bado Kenya, lakini kule nje bado ziko. Where wanafanya kuna procedure ya kufanya zile nodules zikuwe ndogo. Kitu kingine, kuna mgonjwa ameulizwa hapo kuwa anasema ndio thyroid gland yake imefura na pia kuna lymph nodes zimefura. Thyroid cancer is a very rare form of cancer, but it's lethal if it is not picked early. Ndio maana huwa tunasema kama umefura na kuna nodules pale ndani, lazima upigwe picha. Kuna ule mtaalamu wa radiology, kuna vile wanaviangalia na kujua kuwa ni gani inaweza kuwa na cancer na gani haina. Na tukifuata hiyo njia tutajua kama unayo ama una na tukuanzishe matibabu mapema. Yeah.
Sarah, how was your experience? Because you also had the medical part, baadaye ukafanyia upasuaji. What is your experience with your surgery, and how has that evolved to now? How are you doing today?
So my surgery went on very well. I thank God for my family. And I also had a very good doctor. So he knew what he was doing. So I did what we call a partial thyroidectomy. And after that, I did experience some hypothyroid symptoms. But after I embraced a good diet and lifestyle, now, thank God, I am off medication. And yeah, I'm doing good.
How often do you do your thyroid testing, and are you still on the medical management?
Honestly, the last time I did my thyroid test was almost like 3, 4, 5 years ago. Because after that, the doctor told me, I think you're good. After once the body stabilizes and it's used to working with half a thyroid gland, it knows how to adjust. Then after that, now you just support it with a good diet, nutrients, and a good lifestyle. Yeah.
Okay. Hello, we have a call.
Hello, Daktari.
Hello, Margaret. Karibu Uliza Daktari.
I suffer from hypothyroidism kutoka my primary school. Hypo. And ikawa bado mpaka saa hii ime affect voice yangu. It's hoarse.
Naam, swali lako.
So is there anything I can do apart from the surgery? Naweza fanyaje at least ndio niwe na life voice irudi, alafu I'm ever cold. At least hiyo baridi nayo ishe. I can't even lose weight. Naendelea tu ikiki.
Naam. Asante kwa swali lako. So Margaret is having hypothyroidism. Yes, she says surgery, she does not want surgery. Okay. So she's only what she can do. She has cold intolerance, anasema baridi all the time, weight gain.
So unfortunately, and maybe I'll speak in this forum, there are patients who don't even get better, even despite balancing their thyroid function. You'll get like 5 to 10% of patients still complaining of the same symptoms. They need to be evaluated for other things that could be causing the symptoms. But on the basis of that, if you've undergone thyroidectomy, tumetoa ile thyroid, alafu tunakupea ile hormone, huwa tunapima ni kiwango gani ya dawa unahitaji ili mwili yako iwe balanced. So I think for her it will be better if she could visit a doctor and just have a review again of that thyroid function. Unaweza pata pengine ni ile kiwango ya dawa yenye anapewa haitoshi. Na kama si hiyo, kunaweza kuwa na vitu vingine ambavyo vina cause yeye kukua bado na zile symptoms.
I know stones will be thrown if I do not mention salt in this discussion. So Dr. we're curious to know uhusiano wa chumvi, table salt, and thyroid inaanzia nini? And we have one more call. Hello. Hello, karibu Uliza Daktari.
Majina naitwa Han. Nilikuwa na shida ya hormonal balance. Nikaenda kwa daktari pale Nairobi Hospital.
Naam.
Nikapimwa. Nilipimwa mimba, nikapimwa kama hormonal balance iko sawa. Alafu wakanipima thyroid.
Wakasemaje?
Wakasema nini hormonal balance aziko balance. Wanafaa nipe madawa, alafu wakanirudisha tena wakanipima thyroid. Wakasema thyroid yangu ndio iko na shida, inasababisha nisipate mtoto. Na inaweza fanya hormones zangu sikue, ndio inanifanya ni bleed sana.
Naam.
Ndio nimekuwa nikibleed for like a year and 2 months. Sasa shida inaweza kuwa nini? Na inaweza pata aje dawa.
So tatizo lako kwa kweli is a common problem when it comes to fertility issues. Na lazima tuangalie tujue kwanza, vile daktari amesema kwa mara mingi, which thyroid problem do you have? Manake kutibu thyroid ambayo imeenda juu, that is hyperthyroid, ama ile imeenda chini, hypothyroid, zinatibiwa tofauti. Lakini kabla hujaweza kupata mimba, ni vizuri kwanza hiyo shida ikuwe control. So first we need to know which condition is it. Kama it's hypo or hyper. Daktari amesema kuna treatment ambazo they are not appropriate kama unataka kushika mimba. So kwanza tujue shida yako ni gani, then tujue what is the best treatment for you. Pengine utahitaji dawa peke yake, alafu dawa ikiweza kustabilize hormones zako, then you can proceed and get pregnant. Baadaye kuna ule anahitaji surgery, itafanywa ile operation, alafu baadaye ushike mimba. Manake we know recognized complications of thyroid dysfunction in pregnancy include even miscarriages and preterm birth. So mambo haya yanaweza tokea if we don't control this thyroid function. So the first thing tunahitaji kutoka kwako ni the actual diagnosis. Baadaye tuelewe zile dalili unazo, which symptoms do you have, then now we choose an appropriate treatment for you. So Daktari, we're back on the topic of table salt and how it relates to this gland and why we have all this discussion around.
So there's a history to this, and the history is one of the most common causes of thyroid disorders was iodine deficiency worldwide, and especially in developing and countries. So they decided to make sure this iodine is available for everyone. They iodize the salt. So it's an easy and cheap way because nyumba mingi zinatumia salt. So yes, that was the only and best way to combat this iodine deficiency worldwide.
So someone who asked Daktari, how can I prevent thyroid disease? So would this be your answer to what we can do as a general public?
Yes, exactly, because you see, things like goiter, which come about because there's little iodine in your food. To combat it, you just have to have adequate recommended iodine intake, and you'll find it basically in salt. And there are other foods where you can get iodine, but remember, the thyroid gland is the only gland which actually uses iodine for the sole purpose of creating a hormone. So you need to have adequate amount of iodine for you to not have this disease. I cannot say there is a foolproof way of preventing this, because maybe you might have an autoimmune thyroid disorder which is sort of genetic. Surveillance is good enough, especially if you are at risk. You get it. When you maybe suspect you have goiter, or maybe you have those symptoms,
yes,
it's good to have yourself checked. Yeah.
Okay. Daktari, what would you say are some of the common complications, especially when this disease has not been well controlled? Tumesikia wagonjwa wengine wakisema pressure ilikuwa inapanda. Ni mambo yapi, which are the other associated things that sometimes come with this thyroid issue?
Sana sana ni zile vitu ambazo tunaziita cardiovascular complications. And especially kama una produce hormone excess.
Naam.
So unasikia, kuna wengi wanasema hapa, unasikia roho inapiga sana, kuchoka. So ile kukimbisha roho juu ya ile hormone kuwa excessive, tunaweza patia ile roho yako ikuwe na strain ambayo haihitaji.
Naam.
Na tukipatia hiyo strain, unaweza pata roho ianze kupiga vibaya, ile kitu tunaita atrial fibrillation, upate roho inafura ile kiwango ambayo haitakikani, pressure ipande juu, na sana sana kwa wale ambao wako na miaka za uzee. So hapo ndio huwa tunakuwa careful sana, especially ukiwa na hizi symptoms ambazo ni za hyperthyroidism. Hypothyroidism pia, on the other hand, zile vitu ambazo tunaogopea sana ni zile tu cardiovascular, roho inachosha, kuwa slow, unaona vitu kama hizo, pressure pia inapanda. So na sana sana isipotibiwa kabisa, utajipata uko kwenye ICU. Kwa sababu pia mwili ikidhoofika kwa sababu haina thyroid hormone, metabolism ina slow to a point whereby inaweza kuleta madhara. Na pia ikikuwa excessive, unaweza jipata roho inakimbia sana, unajipata umedhoofika, kuna hiyo heat intolerance, unaweza pata umefika ile kiwango ya complication ambayo unajipata uko katika hali ya madhara kule kwenye ICU.
Naam, kuna swali hapa anasema, hi, mine was initially hyper and went to hypo. Now there are nodules and I'm not on any treatment. The doctor says that I should wait and see, though my BP is high. Anasema, please advise. Mwingine anasema, hi daktari, nimetoka hospitali last week. Nikaambiwa niko na hypothyroidism. Hormone iko 14 after treatment. Will it go back to normal?
Well, ina depend. Unajua zile vitu zote ambazo tunaangalia, kuna zile causes, kuna zile ambazo tutasema ni chronic conditions za thyroid. No. Na kuna zile pia tunaita acute transient complications. Zile ambazo thyroid disorders zenye hazitakaa kwa muda. Unaweza pata maybe kuna injury ya thyroid, kuna inflammation ilifanyika pale. So lazima tujue ni gani ambayo uko nayo ndio tuitibu vizuri. Kwa sababu si kila mtu ambayo ako na thyroid disorder yenye ni permanent. Kuna wale ambayo wako na thyroid disorder yenye ni kwa muda alafu inaenda. So pia lazima umuone daktari ambaye atakusaidia kujua ni gani uko nayo ndio ufaidike. Na si thyroid zote ambazo inahitaji hiyo dawa vile unasema. No. Kuna zingine ambazo tunaweza kupea tu zile dawa za kukinga symptoms depending na ni wakati wa gani umepatikana. Pengine ni wakati umemaliza kuwa mjamzito, unaelewa, ama ni wakati umepatikana na injury ya thyroid ambayo si permanent. So tunaweza kukupea vitu za kucontrol zile symptoms na ukue sawa. So si kila kitu ni chronic.
No.
Kuna zingine ni za acute alafu zitapotea.
Zinatulia.
Yeah.
Now, dear Daktari, do the supplements and a herbal treatment work the same way as medicinal treatment, or is it a waste of money? Mwandawiro kutoka Mombasa nataka kujua. Sarah, I would like your reaction as a patient.
Tuache Sarah hiyo.
Do you have any thoughts on this?
Mimi husema because some of these kama vile daktari amesema autoimmune ni lifestyle, it is about lifestyle. Na kama uko na anything that has to do with autoimmune, of course it has to do with nutrients depletion, your gut health, stress, environmental factors and all that. So yeah, sometimes unapata saile una replenish your body with the right nutrients, it's going to have an impact, of course. Yeah, but sasa daktari
unajua mimi si daktari wa mtishamba.
Mtishamba ni supplements.
Ni supplements. Ndio kuna hizi ngumzo ambazo zimekuwa juu ya supplements kwa muda. Na tunajua pia kuna zile supplements ambazo zinasaidia thyroid gland kufanya kazi. Kuna vitu kama selenium, zinc, unaelewa, vitu ndogo ndogo kama hizo magnesium. Ndio katika ile mafunzo yetu kama madaktari kuna zile ambazo tunajua zinaweza saidia katika upande gani. Lakini vile Sara amesema ni vizuri kukula vizuri. Ukule healthy, ukuwe na nutrients za kutosha, uache kuwa na stress kwa sababu medicine si dawa peke yake. Ni vile pia unajitunza huku nje. So ndio kuna specific roles za hizi supplements in the medical field. Lakini najua kule nje kuna maneno mengi kuhusu hizi supplements zenye singependa kuingilia kwa wakati huu. Lakini ndio ziko na roles zake.
We have a 19-year-old asking, I have never had my menstrual period. I have gone for treatment where doctors tried to induce my periods, but no bleeding occurred, and I experienced severe pain. I have been diagnosed with a thyroid disorder and recently had part of my thyroid removed. I would like to know, is my missing period related to my thyroid condition, and is it likely that my period will start now that I have had the surgery? Interestingly enough, earlier this week I had another patient who also had never gotten her period at about 33. So one of the first things we do look at is the hormonal profile. But if we're having completely no periods and then we're also finding a thyroid dysfunction, I tend to think there might also be some global issue going on with all the hormones and not just the thyroid hormone. I don't know what your thoughts are on that, Daktari.
It's true. You know, thyroid function, basically, one of the things it affects is the fertility. And there's a way in which we review that to just make sure that if it's the only component affecting fertility, then you manage it. But you being an obs guy, you know that there are many other issues.
Hormones, there's a whole interplay.
So the pituitary gland secretes these many other hormones that could be affecting fertility. So yes, she's right. The thyroid function could be one of them.
But it may not be the only one.
But it may not be the only one.
So Sarah, just in parting, we've had a lot of patients saying they're having symptoms just like you. What would you want to say in closing to anyone experiencing symptoms like that?
So for me, the clarion call would be, go get checked. Don't wait for the symptoms to manifest so that you go seek treatment. I think this is a conversation that we need to have nationally. As you can see, patients are calling from all over Kenya. So it's important to just go know your status. That's what I like to say. You can see 19-year, it doesn't know how to choose age. You can have congenital thyroid disease, kids born with thyroid disease, young people, people of reproductive age, and even older people who are probably treating other conditions. So all I would say is go get checked. Don't wait. Go get checked.
All right. So I think that's an important thing. And I think you also mentioned something about having the right doctor treating you for that.
Yes. Make sure that you are seeing the doctor that is supposed to deal with such endocrine issues, called an endocrinologist, somebody like Dr. Mbui here. And because as you can see, he knows how to, explain to you. He will draw the chart for you and explain to you in such a way that you feel satisfied. And when you go home, then now you know what to do.
Okay. Thank you so much, sir, and Dr. Mbui, for sharing your wealth of knowledge with us. Little did we know that such a small organ could control so many things. So that was it today. We were talking about the thyroid hormone, amatezi ya shingo, and we have learned about all the many functions that it controls. So if you're feeling a little too hot when it's cold or a little too cold when it's hot, then that might be one of the first symptoms that might mean that you need to get checked. So if you've missed this or any of our other episodes, please note that we are on View Sasa and also streaming on YouTube. And we'll be here next week on Sunday starting 8 p.m. for another episode of Uliza Daktari. Nairobi.